Welcome to AdventHealth Transplant Institute at Porter. In this video, we'll be going over patient education for kidney transplant and what to know before transplant and the evaluation process. At AdventHealth Transplant Institute, you'll experience a rich community history. We have decades of dedicated transplant experience. In 1988, our first kidney transplant was performed at what was then known as Porter Adventist Hospital. Since then, we've added other transplant programs and continue to grow our expertise as the AdventHealth Transplant Institute. Here you can see a picture of our main campus at AdventHealth Porter Hospital in Denver, Colorado. At AdventHealth Transplant Institute, we put you at the center of your transplant team, surrounded by the specialized guidance of our compassionate, experienced physicians, surgeons, and staff. When you apply for a kidney transplant, your case is assigned to a transplant team that includes a transplant assistant and a transplant coordinator who help guide you through the evaluation process. Your support team also includes many other members, like a transplant financial coordinator who will verify insurance coverage and work with case managers regarding benefits for transplant, a transplant social worker and transplant dietitian who will conduct evaluations and connect you with resources, a transplant pharmacist will review your medications and advise how they might change after your transplant, and your transplant surgeon and nephrologist will complete a health history and physical assessment and make recommendations related to the best treatment options for you. Transplantation can provide a better quality of life when compared to dialysis, but it requires a commitment to lifelong habits that will help reduce the risk of kidney rejection. It's important to note that a transplant is a treatment option, not a cure. All kidney transplant candidates will need to ensure the following is in place before they can be evaluated. First, committed caregiver support, including friends and/or family who will help you as you recover from your surgery. They will need to transport you to frequent follow-up appointments following your transplant surgery and help with other at-home needs. Second, a solid financial plan. You will need adequate medical coverage and in some cases be asked to save and maintain adequate funds, which will help ease any potential financial hardship related to copays or prescriptions after the transplant surgery. During the financial assessment by the transplant financial coordinator, your insurance provider will be contacted and a request made to obtain authorization to perform an evaluation with you. Depending on your coverages, you may be required to show proof of savings, which could be set aside to cover any out-of-pocket costs that your insurance does not cover, such as hospital deductibles or medication copays. If this is needed, it would be required prior to approval to be on the list. Fundraising for out-of-pocket expenses is a great way to offset time away from work for you and/or your caregiver, as well as medication copays. Once our nurse coordinator reviews all your records and a financial authorization is obtained, we will begin the evaluation process by scheduling multiple appointments in our center. The length of time needed for an evaluation varies for each patient and their specific medical conditions. Completing appointments as scheduled will help you stay on track with your evaluation. To take you through a step-by-step process of the evaluation, we will generally have you complete diagnostic testing prior to being seen in the transplant clinic by the transplant team. You will also complete urine testing, tissue typing, blood typing, viral serologies, and drug screening. If you're at your evaluation today and you have not yet completed all of your testing, that's okay. We're still happy you're here, and you will be able to complete your testing at a later time. Depending on your test results or medical history, we may request further diagnostic testing or consultations with specialists. During your transplant evaluation, you will be meeting with a transplant social worker. During the psychosocial assessment by the transplant social worker, you will review the role of your identified caregivers and the need for putting this plan in writing. The social worker will discuss any mental health history, substance use, employment status, living arrangements, coping mechanisms, and your readiness to undergo surgery. A caregiver support agreement will be required to be completed and signed prior to being placed on the waiting list. You will meet with a dietitian during your evaluation for a nutrition assessment. During the dietitian assessment, our transplant dietitian will review your current diet and make recommendations on diet needs before and after surgery. The transplant dietitian can provide resources for reaching a healthier weight before surgery if weight loss is needed. You will also be meeting with a transplant physician and transplant surgeon during your evaluation. The transplant physician and surgeon will complete a health history and physical exam. They will make recommendations related to the best treatment options for you and evaluate if you are healthy enough to undergo the stress of surgery and recovery. They will recommend vaccines such as hepatitis B to help you prepare for transplant. You may require additional testing based on the results from evaluation testing and examinations. After you have completed all required testing and interviews with the transplant team, your case will be reviewed by selection committee. This is a meeting where the transplant team gets together as a group, and the medical, surgical, administrative, and financial transplant team will discuss your case and will decide as a group if you are ready to be placed on the National Kidney Transplant Wait List. There are many reasons why a patient may be found unsuitable for a transplant. Many times, it is the combination of multiple factors that causes concerns. Please remember that as the transplant team evaluates patients, we want to reduce harm and make sure that getting a transplant would cause more benefit than risk, and we do not want to harm you by giving you a kidney transplant. Some examples of reasons for denial could be drug use, abuse, or dependence, lack of caregivers or transportation, and non-compliance with a medical regimen. Some medical or surgical examples of why you may not be a candidate is if your heart is not strong enough for surgery, if you have vascular conditions such as calcifications in the vessels where the organ would need to be placed, if you've been recently treated for cancer, if you are too sick for surgery or have low mobility and frailty, if you have multiple medical conditions, recurrent infections, or complicated obesity. If denied, you have the right to seek a second opinion from another transplant center. Our goal is to have a safe surgery and better of quality of life for you. Dialysis, such as in-center or at home, may be the best alternative if transplant is not an option for you. We will now discuss what to expect on the waiting list if you are approved for kidney transplant. We will discuss what the requirements for staying on the waiting list are and how donor matching works. It's important to note that kidney allocation is controlled by the United Network for Organ Sharing, or UNOS, and not the AdventHealth Transplant Institute. UNOS is a not-for-profit organization under contract with the Department of Health and Human Services to maintain the National Organ Waiting List. They monitor every organ match to ensure that organ allocation policies are followed. Once you're placed on the kidney transplant list, you'll begin to accrue wait time based on the following. If you have not yet started dialysis, wait time will begin on the date that you are listed. If you are on dialysis, wait time will begin from the date you started dialysis. If you had a previous kidney transplant and are back on dialysis, wait time begins from the date that you returned to dialysis. Let's talk about matching on the list. Every deceased donor kidney is given a Kidney Donor Profile Index score, or KDPI. The KDPI is based on a score of 0 to 100%, which is associated with how long the kidney is likely to function after transplantation. If you look at the picture on the screen, you can see that the score of 9 is expected to function for a longer time. The score of 82 is expected to function for a shorter time. It's important to note that kidney indexes that are higher do not mean that they are not quality organs, and many factors such as age of the donor are used to determine this score. As a transplant candidate, you will also receive a score. You will receive an estimated patient transplant survival score, or EPTS. Your EPTS score is calculated by UNOS and based on your age, the length of time you've been on dialysis, if you have had a previous transplant, and if you have a current diagnosis of diabetes. You'll receive your score when you meet with your transplant care team. This score is associated with how long you will need to have the kidney functioning after transplant. Much younger patients will require a transplant to function through more of their lifetime than others. Both the KDPI and EPTS scores are then fit to one another in UNOS according to the need of the patient and the estimated quality of the organ. Kidneys with a KDPI score in the higher range, such as greater than 85%, do not mean they are not good organs, but may be best matched to patients who are older, as they may decrease waiting time and expand your pool of options. Patients will need to consent to being offered kidneys in this range, and our physician team can provide more detailed information when you are seen. Kidneys with a KDPI score at or below 20% will be offered first to candidates with an EPTS score at or below 20%. This commonly includes pediatric patients and young adults. Please know that there are many other factors that are taken into consideration when matching organs to recipients, such as blood type, tissue matching, and patients with high antibody levels. Our team focuses on making sure we match each patient to the right organ for them. Our highest priority is giving each person the maximum potential for a successful transplant and long-term health. When we're talking about types of donors, there are some donors who are marked as having risk behaviors. All donors are screened for infection risks at the time of organ or blood donation. An example of someone who may be a risk donor include donors that have used drugs or were in jail within 30 days of the donation. Due to the shortage of organs for transplant, all possible donors should be considered for transplant. Before considering an organ that presents with high-risk criteria, please be aware that the risk for undetected infections like HIV, hepatitis B virus, or hepatitis C virus infection is extremely low, since the testing used is very sensitive at picking up these infections, but we do have to let you know that the risk is not zero. All transplant recipients will be tested for HIV, hepatitis B virus, and hepatitis C virus after transplantation, and should transmission occur, effective therapies are available. Another type of donor that you may consider for receiving a kidney transplant is a hepatitis C positive donor. Deceased donors that are known to be infected with hepatitis C virus can be good donors. Accepting an organ from a donor who is infected with hepatitis C, or HCV, may allow you to have a transplant sooner than if you waited for a donor who does not have HCV. Current treatments for HCV is very effective, curing over 98% of patients. Your transplant physician will speak to you about this option in detail, and a consent to be offered these organs will need to be signed if you are interested. You will have responsibilities while on the waiting list. There are many factors that could affect your time on the transplant waitlist. After you have been added to the list, you will be expected to communicate to your coordinator if you experience any of the following. If you move or have any changes in contact phone numbers, because we always need to be able to get a hold of you, especially if an organ offer comes your way. If you start or change dialysis centers, we need to know that. If you change or lose your insurance, we need to know so that we can make sure that your new insurance is compatible with your current kidney transplant listing status. If you're hospitalized or diagnosed with any serious illness, we need to know about that as well. And if you receive any blood transfusions, we need to know because that can affect the level of antibodies in your blood, and we may need to do additional blood testing. While you're waiting on the list, you'll also need to carefully maintain your health and keep up with routine screenings like mammogram, pap smears, colonoscopies, cardiac clearance and testing, and annual visits with our transplant team to confirm you continue to be a good candidate for transplant. Reminders will be sent by our team to help you maintain an active status. We encourage you to keep all items up to date, such as setting up future appointments in advance to remain on track. Your waitlist responsibilities will also include sending in a monthly blood sample. Kits will be provided to you or to your dialysis center who can help collect blood samples. If you are not on dialysis, you will need to take the kit to your preferred lab or schedule an appointment at Porter Transplant Lab to have this drawn once a month. Having a monthly sample will ensure we can start compatibility testing as soon as an organ becomes available and helps you avoid being passed over for a potential transplant. If you are not up to date on your monthly blood samples, you may be inactivated on the waiting list until you obtain a current sample. You can see up in the right-hand corner of this page, ClinImmune is the lab that we use for tissue typing labs, and so you will be receiving kits in the mail from ClinImmune lab if you are not on dialysis. If you are on dialysis, then your dialysis center will draw this for you. Let's take a moment to talk about the gift of living donation and the benefits of living donation and how it can help you avoid waiting for a kidney transplant. Living donation is another treatment option for you. When you're on the kidney transplant list, you can wait for a deceased donor or find a living donor willing to give you this generous gift. A living donor can be a spouse, parent, child, sibling, close friend, coworker, church member, neighbor, or anyone who is willing to be screened for eligibility and then tested for compatibility. Please keep in mind that if you are not on the wait list, but you have a living donor, you will not be able to receive a living donor transplant until you are on the waiting list. Some benefits of living donation are that living donor kidneys last twice as long on average as deceased donor kidneys. Living donor surgery can be scheduled in advance, which allows you time for planning and coordination of recovery care, and the cost of the living donor evaluation, surgery, and hospital stay are covered under the organ recipient's insurance. To briefly go over some criteria for living donation, please know that living donors are evaluated by a completely separate transplant team and all medical information is kept confidential. This means that if you, as the recipient, have any questions about your living donor, the living donor will need to contact their transplant team and their living donor team to have any questions answered. Your living donor can answer any questions or tell you anything that they feel comfortable with. Living donors must be at least 18 years old, be in good general health, and apply online to begin the screening process. Potential donors should apply online at porter.donorscreen.org. Once they have applied online and submitted their screening form, the living donor team will reach out to them with next steps. Next, we will talk about life after kidney transplant and what to expect for your recovery and long term. After you've been discharged from the hospital after receiving your kidney transplant, you will be required to follow up in the post-transplant clinic to be monitored for acute rejection and infections and have medications adjusted if needed. You'll be seen twice in the first week following transplant, and then once per week, and have labs drawn twice weekly for the first month after surgery. In the second month post-transplant, you will have weekly labs and bi-weekly clinic appointments. After 1 year post-transplant, you will most likely be referred back to your general nephrologist to manage your kidney care and medications. All patients will be required to come back to the transplant clinic for an annual visit for the life of the transplant. When you receive a kidney transplant, you'll be placed on immunosuppressant medications that help lower your immune system on purpose so that your body doesn't try to fight off that organ. Part of your post-surgical care includes taking immunosuppressants that will help reduce the likelihood of rejection. These must be taken for as long as you have your transplanted organ. You'll also be prescribed medications that will help minimize certain side effects associated with the transplant. These prophylactic medications are taken temporarily, usually anywhere from 3 months to 1 year post-transplant. It is very important, and you must be able to afford your medications post-transplant, so it's important that you're aware of what your insurance will cover. Talk to your transplant financial coordinator before making any changes to your prescription coverage so that you know how it will affect you getting your medications. You will be expected to check with the transplant team before you take any over-the-counter medication or medication not prescribed by the transplant team so that we can advise if this will interact with your immunosuppressants. Do not take any herbal supplements without consulting the team, as many supplements such as turmeric can interfere with your immunosuppressant medication. Our transplant dietitian will also advise on what foods to avoid that can interact with your medications, such as starfruit, pomegranate, ginger, and grapefruit. A commitment to the medication and lifestyle changes directed by your care team will help you stay healthy for many years to come. That concludes your pre-kidney evaluation education video. We hope that you enjoyed the video and that you learned something new about kidney transplantation and the evaluation process. Please review your schedule that was given to you at check-in today so that you know who you're seeing and at what time, and stay put. And one of our team members will be in shortly to see you. Thank you and have a great day.